Hello and welcome to Dragon Bytes, the paediatric podcast aimed at paediatric trainees or anyone interested in child health. I'm Asim, one of the paediatric trainees here in Wales and one of the presenters for Dragon Bytes. This week we're going to continue our interview with Kerry Franklin. Kerry Franklin is a youth support worker who works for the charity No Limits. She joined Tom Cromarty and Rebecca Jones, two of our Dragon Bytes presenters, last week to start discussing her role with the No Limits charity and her work in emergency departments, supporting children and young people. Anyway, let's get started.
And you've talked about some of the instances in which you would become involved, and you've said that sometimes the staff would say they're medically fit. Can you come and have a chat with them as well? Is that what would you say is the kind of a day in the life of Kerry? Kind of how many children would you be seeing? I suppose it's very variable, isn't it? But what time are you seeing them? That kind of thing. What does that kind of look like on a practical level?
So I try and vary my shifts. I do some weekends. I do a late night on a Tuesday. Most of the time I'm in Monday to Friday. But an average day. So Southampton, we have what we call the room of requirement every morning. So we have a half an hour opportunity to do some learning. A member of the team will opt to choose a subject to talk and teach everybody else about. So I'm often rotated in on that. So I might do a half an hour discussion on young people's behaviour or anger management. I've recently done one on sexual health. I've done a half hour teach session on LGBT issues. So that's kind of the morning started. I'll do the handover, see who's in, who's gone up to the wards. So then I've got a general idea of where I might go. We have a short stay area, so I'll go and see some of the young people that have come in overnight, and they might be a mental health crisis, abdominal pain, injury, drug and alcohol related, or eating disorder, for example. So I might see 2 or 3 young people downstairs. I'll link in with our CAMS liaison teams as well, because sometimes the information that a young person's talked to me about isn't something that they've necessarily spoken to a CAMS nurse about. So it's about sharing information as well, and confidentially and stuff like that. The CAMS team might also have somebody that they might want me to go and see who's not on their threshold, but could do with some youth support outside of the CAMS criteria. And then I'm constantly looking through to see who's coming into the department. And again, because of our age group, I'm looking to see who's in adults as well. Southampton, we've got a vulnerable adult support team. So I go and link in with them, and they'll quite often ask me to see one of their patients who might be 24, heroin addict that's a frequent attender to the emergency department. And so my day is chock-a-block. I'm lucky if I get a lunch break. And then, of course, I've got all my admin to do, referrals, signposting, writing safeguarding things, follow-up phone calls with young people. Probably on average, I see 4 or 5 young people a day. And any one of them, I might spend anything from half an hour to I've spent a whole day with somebody before, because the level of trauma crisis they're in. So it's an unpredictable day, probably the same as everybody who works in the emergency department. But because Southampton's such a big hospital, there's always young people in it.
Amazing. And I just to final on that point, I think just having you in the department, and like you say, you're expertise and teaching in those quick half an hour, 20-minute formal sessions, or even just the conversations that people can have with you just for a little bit of extra information on what to do, is going to kind of, like a ripple effect and just upskill the whole department on managing children like that. So I think that's amazing.
Yeah. A lot of the new doctors find it really interesting because they're like, I could never have spoken to a young person about anal sex or where to get free condoms. I would never have known how to even start that conversation. And they're like, you've done it so easily. And I'm like, but that's because I'm not scared to talk about it. So it's passing on that skill, really.
Yeah, that's all I was going to say, is that I'm just at the start of my PEDS training, and I was just thinking about how these moments and having you in the department to help teach trainees or non-trainees, anyone that's in the department that's interested, on how to start these conversations, means that you then also get more time. Like, if someone else can also help start a conversation, then you're skilling people so that, say, I might feel more confident to talk about sexual health with a young person, which means that you can then focus on someone else that's maybe closer in crisis and things. So it's really good. It sounds like Southampton have got a really good setup as well.
Yeah.
So on that, Kerry, what are your, if we can get some top tips on just maybe three top tips on talking to young people? What would they be for you?
I think most of all is just really be non-judgmental. And I know in some instances it is really hard to be non-judgmental. But if you can really dig deep, because somebody, for example, who is a heroin addict, nobody woke up to choose to do that. It's something that has happened to them because of their circumstances or peer pressure or something. And I think it's really important to just remind ourselves that, they're not necessarily choices I would make. But, this person is vulnerable and they need my help. So being non-judgmental in every aspect. So, whether you're greeted with a 14-year-old who's worried they're pregnant, or, a 25-year-old who's frightened to come out because they're gay or something, it's about being non-judgmental, even if it's against your personal values. And I know probably everybody I work with is very non-judgmental, but it's a key thing for people to open up to you because it makes them feel safe. And we know that feeling safe is one of the best things to help young people achieve. I think, as all staff, if you know what is in your local area, you know what all the local support groups are, whether that's if you have got a young person who has tested positive for a pregnancy test, for example, if you know where to signpost for all of that local support that young person's going to need, it just makes their decision process so much easier when they leave your care, whether that's you're signposting them to like a young mum's antenatal group, for example, or a clinic that can offer clinical support for that person's decision. And again, base that on being non-judgmental, but like professional and knowledgeable. That again goes a long way to helping that young person know that they are supported in their community. So I always say, especially doctors who are moving around nationally, I think one of the first things that you should do is look on your local council website and find out what all of these services are available to all of your patients. I think as well, lots of people I speak to who don't often engage that much with young people, they often say they feel a bit scared of young people, or like they feel intimidated. And I do completely understand that. I've walked into some cubicles and I've been greeted by like somebody with their hoodie up and they're not going to give me eye contact, and and they look quite threatening, but actually underneath that is a very scared, vulnerable young person. And just try not to be scared of them, because they're actually really nice people. They're really lovely when you get to know them.
That's what I find as well. When you can get them talking, they're always, they're quite clever. They're really interesting, and yeah, really nice people.
Yeah.
So that was really, really great tips then. So non-judgmental, and I suppose that means your face has to be non-judgmental as well when you're hearing these kind of things.
Yeah, facial leakage.
Facial leakage. One of the things that I always remember is that one of the kind of GPs that does podcasts called Rangan Chatterjee, he says that if you consider that everyone's got different experiences in life, and if you had the same life experiences as them, you'd make the same decisions as them, then you can become less judgmental. I like that. And then you said knowing your local area, and support groups. And I think David James would be angry if we didn't mention the Heads assessment app, which has got, I think it's local to a few different areas, but also got national things. Do you know a bit more about that?
Yeah, so if you, I use it a lot because I go from Basingstoke to Winchester to QA, and every time I work in a different hospital, I just change my setting to like Portsmouth, and then it brings me up all the local youth support for Portsmouth. So in Portsmouth, we've got youth services, and Motivate are the local ones to that area. But also they will have different, like they'll have a different homelessness contact number, they'll have a different rape crisis contact number, different sexual health services. So yeah, if you've got that app, or you can have that app on your phone, definitely put it on, because it's such a brilliant toolkit, and it gives you those leading questions to open those conversations with young people. So whether, if you think that a young person has got a bit of a mental health issue, but it's not that obvious, you can just click on that tab within the app and just discuss. So how's your mental health? How are you coping through lockdown? Or, that, have you got exam stress and stuff? So it's just giving you that toolkit all in one place in a fancy app that does all the work for you. And it will help you signpost to young people their local areas. I think there's an option on there that you can fill in referral forms with the young person as well. So if you've got time and the department's not overly busy, you can sit with the young person and do the referral and send it to their phone.
I didn't know that existed, so thanks, guys. I probably should have known that existed, but I didn't know that existed. We've spoken a lot about like the stuff that you do with young people, but are there children and young people involved in the development of the services within like No Limits, and do they give you feedback and get involved themselves?
Yeah, so No Limits is one of our service managers often refers to us as the fourth emergency service. And I think she's quite right in saying that. And one of the things that we do, we have kind of embedded ourselves within the community, and we, as an organisation, I think every year we do a big survey for all of our young people. So whether they're part of a youth group, part of our young carers group, we ask them to fill in a survey. It's called a Have Your Say survey. And we do that every year. And we get really vital feedback about how we can improve our services, what support and access would they benefit from that we don't already have. So it's a big survey that collects that kind of information. Within the teams ourselves, we'll often do feedback forms. So at the moment, we are still collecting feedback from the young people that we've engaged with at the hospital. And a lot of that's been gone into the report that I sent you earlier, like the impact report. No Limits also does its own impact report for our commissioners. And yeah, I think we have our youth advocacy service as well. And a project that I worked on last year was a mental health youth champions project as well. So it was about recruiting young people in schools to be kind of peer mentors for the people in their school, and stuff like that. So we do constantly review our services. We get information from our youth ambassadors. A lot of our information comes from them because all of our support is targeted to them. And if we're not doing it right, then we need to know about it. So, and young people are very honest. They like to tell you everything, and give you their opinion. So it's really valued.
So you said the impact reports go to the council, did you say? I'm just wondering, how does the kind of funding work, and for kind of getting people like yourself into positions in the hospital? How does that all come about if other departments want to try and get that going?
I think so. No Limits, because we have so many different youth groups, we have then so many different pots of money. The emergency department funding originally came from the violent crime reduction team within the police service. And that was commissioned to try and help reduce young offenders, and have that teachable, reachable moment with young people who, needed an alternative lifestyle other than the one that they, that's appealing to them through being groomed or whatever. So we weren't really seeing too much of the violent crime coming through the emergency department at that time. And the young people that I was seeing, they didn't want to engage because I think they were quite heavily into county lines and almost unreachable, but possibly through fear, they just didn't want to engage or seek support or be seen to seek support. But it became quite obvious that actually through COVID as well, we were seeing a massive increase in the mental health side of stuff. So we've now got funding from the Home Office. We had funding from Bernardo's. We had funding from some of the CAMs and council support as well. Most councils will have a pot of money that will hopefully go into youth support services. So it's kind of a beg, steal and borrow thing we've got a big chunk of funding at the moment from the Home Office, which is for 6 months' work. So we're hoping to recruit some more youth workers in the hospitals through that. So yeah, it's a rolling project, so to speak. But if your hospital has got available funds through its charity, then it's a worthwhile investment.
So do you see, you mentioned kind of more youth kind of workers and youth getting involved with it. Do you see actual kind of young people who have maybe been through the service then being in the hospital? I know that, in London with things like St Giles Trust and Red Thread, that they have people with lived experience talking to those with, violent crime and knife crime. Do you see that as an option with No Limits then?
We certainly have. Some of our youth workers have been supported by No Limits in the past, and then they're able to be like peer educators, role models. Some of them go on to be our youth ambassadors. I know that we have a young person at the moment who is looking to do some volunteering because of the work that we've done at the hospital to support them. but yeah, it is. I've done a couple of conferences now, and we've got one planned in October, I think, for the peer project, and that's going to be drawing on some young people who have come through the hospital with drug and alcohol related issues, and trying to link that into like criminal exploitation, and just educating the people at the hospital to look out for that. So yeah, I've got a young person that's going to help me deliver that. So yeah, we do draw on our young people, and I think the success on how we've been able to help those young people is reflected in how much they want to give back to the community and support their peers. So it's really positive.
Yeah, it all sounds incredible. It all sounds like really amazing work that you guys are doing, and I just wish every clinical department had something that sounds as amazing as No Limits, because yeah, I think it would revolutionize things for everyone if every department had that.
Yeah, I agree. I was wondering, we've talked a lot about the support that you give young people. What about thinking kind of the wider family? Because obviously that's all a support network for the child and young person. Stuff like housing and other ways to access money. Is that something that you guys do as well?
Yeah, so we have our housing team. We've got a team who help young people make sure that they're collecting all the benefits that they're entitled to. We have our young carers teams as well, which it is set up to look after the young carer, but essentially that will have an impact to the rest of the family. We've got a small group that is run called Cosmo, and that is for young people whose parents are drug users. So it kind of helps to educate the child. It gives the child opportunities to do stuff that the family might not be able to provide. So like in Southampton, we have the big ice rink out in winter and stuff like that, or they might go to Thorpe Park for a day out. And it's things that, when a young person's family is surrounded by drug and alcohol issues, quite often the spare cash gets spent on that, and then the child misses out on everyday adventures. So No Limits fills that gap with those kind of things. We quite often signpost into other services as well. So if we have young people who have additional needs, then we link into like Rose Road Association, which is a family support network for that. The council as well have a Families Matter support group. So we might be able to identify a young person that ticks a few of the needs, the criteria for that, and then we can get that support in place. So yeah, again, we are supporting the whole family, because quite often, a child in crisis will have a knock-on effect to the whole family, and whether that's siblings, and stuff. So in the hospital, I do quite a few referrals for siblings who have witnessed the mental health issues at home, and been able to get them counselling as well. So yeah, it is essentially the whole family, even though our core area is 11 to 25.
I guess it all has a knock-on effect. So if you can have those contact moments where, yes, it's the young person that is the trigger point for you guys to be involved, it's like you say, it extends to the whole family and community. So if you can use those reachable moments to then reach the family as well, then it can hopefully give some hope and signposting to other places. So yeah,
I love it. I love everything about it, Kerry. I'm looking forward to coming down and seeing a bit of it, really.
Yeah.
I know we spoke about our top tips for talking to young people, but like we've already said, not very many departments have a Kerry and have a No Limits.
I think definitely it's worth doing a bit of research for tools, techniques, and support networks in the local community. Like we said earlier, like there's an online counselling tool that's quite new. I don't know if it's national, but it's called Kooth, and that's really good for young people. It's got like a toolkit embedded within this app, and there's an online counsellor readily available to speak to young person if they need it. I mean, if you can have leaflets, if you've got stuff to hand out to young people with information on, then that would be really helpful. Reminding people of the national support networks that are available, like the Samaritans. I know like Young Minds is a really good one. And then a lot of the older, more established stuff like Bernardo's and Children in Need. They've got so much information. The NSPCC do a massive amount of research, so there's loads to learn off of their websites as well. And it's, I guess, if you can educate yourself, and your teams, may have some fun with it. Delegate somebody to look up chlamydia, somebody else to look up syphilis, and then in your next coffee break, give us 10 minutes on chlamydia, and so that you're all knowledgeable about those subjects and stuff like that, and you can share it with each other, or get to know about what signs to look for with anxiety and stuff, eating disorders, the thresholds for CAMS, like waiting list times as well. I guess education is the key.
There's so much to learn, Kerry.
I know.
What do you think in your role is the hardest thing for you to deal with, or some of the kind of barriers or challenges that you've had if other people are going to get involved?
I think, I've definitely pushed some of my own boundaries. A year ago, I couldn't watch squeamish blood and stuff like that. And I hate watching horror movies, but sometimes I feel like I'm in one in a resource. So and a few times I've thought, like, I'm sure I should have fainted by now, but I haven't. I'm still standing. So I think I've had quite a few of those moments. And I think it's I think it's being prepared for anything, and I think that's to be said for anyone in this role and your role. You never know what's coming through the door, but if you're a little bit prepared for it, it will go to help you. I think as well, we always forget we've got so many transferable skills, whether you are good at opening conversations or have a bit of a sense of humour, anything that captures somebody's attention and just, again, making them feel safe. But again, I think knowledge is the key. I've got this thing where one night at bedtime I'll read a novel, like a romance. The next night I'm reading something on psychology. So I'm just tapping into my own knowledge, and I quite often go to the other ED teachers' teaching sessions that are happening as well, because then I learn stuff about anaphylactic shock and all stuff like that too. So I've always felt that knowledge is power, and the more you know, the more you can help somebody. So I'm a firm believer in that.
You're a learning addict. And I suppose one of the things that I've thought recently is that lots of the children, young people that we're coming in with injuries or with illnesses, often, especially with infections and things, are going to get better no matter what we do. And sometimes antibiotics will facilitate that happening faster. But I think that the conversations that we have with these young people, they can really make a massive difference. And having them or not having them can I know it sounds a bit corny, but can be the difference between life and death. And so it's important for people to be able to have these conversations and know the things that we're talking about as well as they can, really. So that's just one of the things I thought recently. But yeah, if you got anything else you wanted to say for any of the listeners, then we'll be happy to hear it. But I think you've covered a lot of tips and a lot of aspects of talking to young people. So thanks very much.
Thank you. I think it's key to remember I'm part of a massive team, not just in the emergency department team, but also within No Limits. We are quite unique, and I couldn't do this job without a team of counsellors behind me, a primary mental health team, a young carers team, a drug and alcohol team, and at the hospital, if the staff there didn't recognise the need for this service, the amount of young people's lives that wouldn't have changed so far, would be quite sad, really, because I know for a fact that we have gone on to change lives. So it is really, really valuable. So thank you.
Lovely. On that wonderful note of changing lots of lives and improving everyone's health, let's leave it there. Thanks very much.
Thank you, Kerry.
Thank you.
And I just wanted to say a final thank you to Kerry Franklin for joining us and to Tom and Rebecca for hosting the episode. Join us again next week for another episode. Thank you for listening to Dragon Bytes.